Hi, everyone. Thanks for tuning in today. My name is Holly-Kristina Averette. I am a graduate assistant with the marketing department at the Dayton Foundation, and I am joined today by Miss Lisa Carter, who is the CEO of South Community. They are an organization in the Dayton area that helps provide counseling and care for people suffering with mental health and substance use issues. So thank you so much for joining me today, Lisa.
Thank you for having me.
Glad to have you here. So I guess we're just going to go ahead and get right into it. So today I want to talk about the COVID-19 Response Fund for Greater Dayton from the Dayton Foundation and Dayton United Way. The COVID-19 Response Fund for Greater Dayton is helping nonprofits on the front lines get the resources that they need to help our community. And recently, South Community was awarded an $18,000 grant for that. And you guys are using that to purchase telehealth equipment so that you can remotely counsel people dealing with those issues. So could you kind of speak to how this grant has helped your organization serve its clients?
Sure. Well, as you said, we are a mental health center where we provide mental health services and substance use, and we really work typically school age all the way through the lifespan. So, before COVID-19, we're community based, but we also had office based counseling, medication monitoring, and so when COVID-19 hit, and telehealth becoming the real viable, service delivery method, we needed help to be able to equip more folks to be able to go remote. And so the Dayton Foundation, and again, I want to first of all say thank you, through being able to get that financial support really equipped us and helped us to equip our outpatient services to go remote so that we did not have really a gap in care. It also helped, we have a day treatment for youth. And so to help with some electronic health record capability, the video conferencing being of utmost, which it's extremely has been helpful to that. And then also we included some monies through the foundation for actually minutes for clients who were running out of their phone plans. And so it's been really a joy to see that come together. Not that there are not challenges, there are, right, with COVID-19 and all that's going on. But I can't thank you enough, again, for the financial support. And it really did equip us to get all of our staff, to help us get all of our staff working remote who are in clinical services.
Well, I will be sure to pass your thanks on to our grants committee, and I know everyone at the Dayton Foundation just is so excited to see organizations like yours, providing essential care for people in our region. So I know you kind of talked about how you guys did things before COVID-19, and now you guys have had to really retool and reorganize how you guys are providing services. So I'm curious, have you guys worked with other organizations that are providing similar services? And, if so, kind of what trends have you seen there?
Well, one of the things that we do locally that I've been a part of for us as an organization is to have briefings on a weekly basis with our Adams board and other agencies like ours, other partners within the community. And what I have found is we've got some of the same successes, we've got some of the same challenges, but the real opportunity I think that I like to underscore in discussions around this is that different agencies, we're taking the opportunities, right, to try to have a seamlessness of care and working together around identifying, yes, there might be challenges. One of the things that not telehealth, but around personal protective equipment. We've had a lot of different kinds of discussions going through COVID-19 around how to make sure that we're mitigating risk, that we're caring for our staff and clients alike, all of that kind of in an ongoing fashion. So I would tell you that I think making other agencies are taking the opportunity around the telehealth capabilities, hospital systems, and then it really requires us working together to make sure that we can help answer clients' questions, if they don't know what's happening across the community. And but I'm seeing like things, and I think that's exciting and very good.
Yeah, I think that's awesome too, that you're able to work with other agencies and you can kind of talk to each other about the challenges that you guys are having and kind of work through that. So that's awesome to hear. I'm curious if you can talk about how we can combat feelings of isolation during this time because, a lot of us are at home right now with the shelter in place order. I know that the state is kind of opening back up, but a lot of people, including myself, are still working remote and in the house, just not leaving. So that can really, really lead to, feelings of loneliness or isolation. So would you be able to speak to some tips that might help combat those feelings?
Sure. I think one of the things that, as you and I were talking, before, that I wanted to kind of emphasize or underscore tonight. I'm big on definitions, and so if you look at the definition of isolation, it's separate, right? And so the
Yeah.
counter to that is to try to be connected. And I think back to whether it's telehealth from a provider standpoint, or that getting connected to family, to loved ones, to support system is extremely important. And so be able to have that phone or that virtual capability. We can't do things all the same that we did, but finding new ways to adapt in this environment. So I would say connectedness. And one of the things that Ohio did was has been a campaign called Strive for Five. And I know organizationally we sent that out so that we could equally help our clients and ourselves, right? Our staff that
Yeah.
reach out, make a point every day to reach out to 5 people. It could be family, it could be friends, it could be a neighbor down the street, it could be an individual that you haven't seen for a while, but make those connections, because when we can do just like what we're doing tonight, right? Being able to
Right.
talk together, then you don't feel as alone. You feel like you can get that support. And so I would underscore that's a big thing, is to be connected. The other things are some of the practical things that we need to try to still have our sleep being, the same, eat right, do those things that we know around self-care and management of that. Those go a long way to help ease some of those fears and anxieties. And then you read a lot about balancing. We get a lot of information, as you know, thrown, in constant, right? Feeds around news and those things. And so again, seeking a balance can be very helpful. And when you're feeling fearful or anxiety, again, reaching out. And knowing what resources there are if you don't have a support system that you can get hold of immediately, and know that there's support there. There's a support if there is a crisis. There's a support. There's a warm line here in the community just for questions, and then being able to make sure that you stay connected.
Yeah, thank you so much for all those tips. I know I will try to use those in my personal life. But I really like that you mentioned about connectivity, and I think it's amazing that you guys are using some of the grant money to provide minutes or cell phones or whatever to people that, may not have the means to stay connected. So that's
Great.
so inspiring to hear that your organization is doing that kind of stuff. So thank you for all that you do.
Thank you.
And I have another question. I'm curious, how could we approach our family members or friends that might be struggling during this time, either with mental health or substance use issues?
Well, one is I think it starts with the conversation, and if you're experiencing, again, if it's a family member, a loved one, a friend, someone professionally, colleague, is being able to know what resources there are, that we're not alone. And again, back to isolation, sometimes you can feel that way. If we're not seeing somebody, are they really still there, So I
Right.
think resources are extremely important. Not having, there's stigma that can sometimes be attached, certainly around mental health, around substance use. Am I supposed to be feeling this way? People are feeling what they're feeling, and that idea to reach out, to know that there are resources. Again, can't underscore enough during this time that there's a warm line that through Adamus and Goodwill Easter Seals, that folks can call and talk about anything.
Yeah.
You can call South Community. If we're not your provider, that's okay. People want to make sure that we get folks directed where they need to get the help that they need. There are businesses that have EAP services. So I would, strongly recommend that, that there are ways to be able to get help, and to seek it, and to try to, really try to calm those fears and those anxieties around this. We're going to be in this a while. And so how we can support one another, and walk through this together, I think is going to be key.
Thank you so much for that. I really appreciate as well that you were, able to provide just some other resources in the community that people can point their family members or friends to, and just kind of being open to having that conversation about mental health during this time. So I do have one last question as we kind of wrap this up. You before kind of mentioned some of the challenges that you and maybe some other organizations have found in moving from face-to-face counseling to fully remote services. Can you kind of talk about some of those challenges that you have encountered and how you guys have been overcoming those?
Sure. One of our big challenges that we had, I think it was ended up being around 18 clients who are on our assertive community treatment teams, which we have. And really what assertive community treatment teams, it's really a hospital without walls. So it's daily med deliveries. It's really trying to keep, folks in their homes or, wherever they're living. And so we had 18 clients who did not even have a phone. So even with the telehealth and those capabilities, they didn't have that resource. So we were able to utilize and refurbish, if you will, or to update some flip phones that we had available. Again, going back to what Dayton Foundation helps with, that financial support, to be able to, we could not provide them a phone to keep, but to provide a strategy with our staff and those clients for continuity of care. So that was a challenge and a way that we went, around to be able to have a solution. We have some, I was just talking with staff earlier today, we have some clients who are getting tired of the phone. They just like, I don't want any more of this. I want that face to face. So we're trying, just like the state of Ohio and our country is restarting, we're looking at that. It's a challenge. So how can we, in terms of continuing to mitigate risk, doing the distancing, doing all those good things that we need to be doing to stay safe and healthy, but to start to provide more of that in-person or that face-to-face care. And so I think, again, there's a challenge there. And I just shared with the staff, keep the conversation going, letting them know that it's not always going to be this way. It is right now, but there are going to be days that we're going to get back to some of our new normal, and I think that's important just to underscore the hopefulness that is found in that. So I think we've had those, kinds of challenges. And then I think the other is our own being comfortable around that new service delivery. So we have tried to provide training, tips for our staff to be able to feel comfortable working remote. Not everyone worked from home. That in and of itself was a challenge. And so I just think every challenge, there's an opportunity to come around, strategies and solutions. And then I think it's in the work. You got to keep doing it every day, and staying encouraged by that. So I don't know if that answers your question, but some of the challenges and some of the ways of coming around with strategies and solutions.
That completely answered my question. Thank you so much. I think it's really amazing that you guys were able to come up with a way to, like I said before, just connect those people that weren't able to connect. And I really like that you also mentioned about your staff. We have all been kind of put into this situation where we are, kind of required to adjust and work remote. So it's really encouraging to hear that you're also focusing on your staff and making sure that, they're fully comfortable in the services that they're providing. And I think that probably goes a long way just to make that service so much better. So that's all the questions that I had today. I really, truly appreciate you taking the time to speak with me today.
Thank you so much. It's been my pleasure. And again, just many thanks from South Community to the financial support, and just knowing that that's going such a long way in terms of helping helping the people within our community. So thank you.
Well, thanks so much to your organization for all that you do. And I hope you guys continue to do great work, and I know you will. So thanks again. I hope you have a great day.
Thank you. And you too. Stay safe and well.
Thanks so much. You as well.